Pop quiz number 140. A preemie gravid woman at 28 weeks gestation takes a 3-hour glucose tolerance test. The results indicate a fasting blood sugar of 100 milligrams per deciliter and a 2-hour post-load blood sugar of 300 milligrams per deciliter. Which of the following nursing diagnoses would be considered the highest priority at this time? 1. Potential for impaired family coping related to diagnosis of gestational diabetes mellitus. 2. Potential for noncompliance related to lack of knowledge or lack of adequate support system. 3. Potential for altered parenting related to disappointment. Or 4. Ineffective family coping related to anticipatory grieving. What do you guys think? And guys, the correct answer is 2. Potential noncompliance related to lack of knowledge or lack of adequate support system. So let's talk about this. Whenever you get a test question that's asking you what is your highest priority, you always need to think of Maslow's hierarchy of needs. You always need to think of physiological integrity. You always need to think of safety. What's going to kill my patient the quickest or keep them alive the longest? Now, what's this patient's issue? What's the problem? The problem is that high glucose. So let's look at the choices. 1, impaired family coping. That's not the problem. The problem is you took that glucose and it's way too high. Look at choice 3, potential for altered parenting related to disappointment. What does that have to do with the high glucose? Choice number 4, ineffective family coping. That has nothing to do with the high glucose. The problem is the high glucose. So the correct answer is 2. Potential noncompliance related to lack of knowledge. Maybe you don't know the foods that you should not be eating or consuming a high amount of. Maybe you don't have that support system, but the problem, which is that glucose, that's what we need to address. Number 2 is the correct answer choice.